Thank you, Mr. Speaker. And I rise today with many of my freshman colleagues to talk about the impact of a very important bill, the Patient Affordability Act, or commonly called Obamacare, on our economy, our caregivers, and most importantly, the American people seeking care. Any day now, the Supreme Court is expected to announce its decision on Obamacare. And while I hope that the Supreme Court rules on the side of the Constitution and the American people, no matter what happens, the fact remains this law is bad policy. It's bad for health care, it's bad for the economy, and it's bad for the future of our country. The rhetoric of the bold promises used to pass Obamacare into law simply cannot be reconciled with reality. The more the law is implemented, the more the American people don't want it. The President's promises on quality of care, lower insurance premiums, no increase in taxes, and no effect on the deficit in just 3 years have been broken time and time again. Broken promise number one. President Obama said in March of 2010, and I quote, "If you like your doctor, you're going to be able to keep your doctor. If you like your plan, you can keep your plan." The reality is, President Obama's very own administration now estimates that the new regulation contained in Obamacare will force up to 80% of the small businesses to give up their current plans by 2013. The Congressional Budget Office also estimates that between 3 and 5 million people will be dropped for employer-based coverage by the time the law is fully implemented. When I visited businesses in my district, I always ask, have you done the math? Will you keep your insurance or will you pay the fine? Time and time again, I get the same answer. We'd like to keep insuring our employees, but it doesn't make good business sense to do so. Yesterday, in fact, I participated in a field hearing in Murfreesboro, Tennessee, on the effects of the government regulation on the economy, and we heard from several business owners and state leaders. A gentleman by the name of H. Grady Payne of Connor Industries, which is a plant in Fayetteville, discussed the impact of Obamacare on his business. He said his company has about 450 employees, and he struggles each year to encourage them to participate in health insurance. The company has had to create different employee groups in order to create an employee base which would have 75% participation as required by most insurance companies. Now, Payne said that the non-discrimination provisions of the health care reform would prohibit this, forcing the company into several expensive options. It could switch from full insurance to self-insurance. It could expand the coverage to all employees and have the employee cost set according to the affordability formula, or it could stop offering health care insurance altogether, instead paying the penalty of $2,000 for each employee. Payne said any of these three options would cost the company more than $1 million compared to the current cost. I'll talk about other broken promises, but I would like to yield 5 minutes to my good friend Todd Young from Indiana, representing the 9th District of beautiful Bloomington. I yield him 5 minutes.
Well,